Hi, I'm Abby, mom to 7-month-old Remy.
Hi, I'm Dr. Laurie Hightower. I am a licensed marriage and family therapist, a licensed professional counselor, and a registered play therapist. And this is Grio's Ask an Expert.
And I'm so excited to be here with you, Dr. Hightower. My background is in social work and public health before I became full-time mom to Remy. And so I'm like inherently just interested in communication and child development. I'm also a researcher. I've done a fair amount of research. And then I'm also just like a Googler, like I Google everything, look up journal articles. So of course that has come out like full bore with having a baby. I'm just looking up everything. And so I'm so excited to be here with you talking about communication and babies' language development. And this sort of came up for me because I had read a few things about the way babies learn to speak and just sort of kept that tucked away. And my husband, I remember kind of near the beginning, I don't know, she was maybe a month old at the time. He said that he was going to try to not talk to her in a baby voice. And I remember I had read something about it's actually good to talk to them in a baby voice. So that led me to my Googling about communication. And three terms came up that just kind of kept popping up. And I wonder if we can just kind of go through what your definition of some of those terms that popped up are. So, what is baby talk?
So traditionally, I think most of us see baby talk and have learned that baby talk is when parents talk to their baby and sort of in that cooing nature, making a lot of like goo goo gaga sounds and really sort of that trying to get in tune with your baby, but it's sort of playful speech. But it also doesn't contain a lot of actual language. It's more of like made up, mixed up words. Um, and I think it gets a bad rap. Sometimes I've heard too the adage of, oh, we're not going to go there. Um,
Mm.
but it does have its place. But that is what baby talk is. It's that cooing and really kind of showering the baby with attention, with our sort of made up baby language and sort of mirroring too. If the baby coos, we mirror it back and we will coo back at them sometimes as well.
So natural to fall into. I don't think I could prevent myself from doing that if I tried, really. So, what it sounds like there might be there's obviously some pros. It sounds like, are there some cons of baby talk? Or could you just talk through the pros and cons of baby talk?
Sure. So the pros and cons of baby talk tend to be well, I'll start with the cons. We'll kind of get them out of the way. So the cons, I think the big one is it has that stigma. It's, oh, you're teaching your baby fake words. You're not teaching them real language. And I think really that's mainly the big con of baby talk is sort of the perception that society has of it at times. Um, Really, I think the pro of baby talk is that baby talk creates connection between you and your baby. And it helps baby understand that when they attempt to engage in their form of conversation, that you reciprocate and you're there for them. And it also models back and forth dialogue behavior with the baby. And so I see that there are benefits to baby talk and that it can actually help baby to kind of grow and develop language skills.
Awesome. So then another term that popped up was parentese. How is parentese different from baby talk? How would you define parentese?
So parentese, which sometimes is also called motherese, um, but we're all parents. Men and women take care of their babies. So parentese is really a type of speech that caretakers have with their babies, where it's an exaggerated way of speaking. So it really is sort of big talk. You see a lot of like hand movement and bright wide eyes, and they're really also engaging the baby in the talk. There's a lot of direct eye contact that happens in parenties that ensures that the baby is engaging, and it also keeps the baby engaged. So they're able to really see that, oh, when I make sounds, my caretaker, my mom, my dad, they are engaging with me. And really, parentees, the difference between that and baby talk is parentees also has more actual language in it. So this is when people say things like, "Oh, you're such a pretty baby. You are so sweet." And so what you see in parentees is really kind of three main things that we're looking at. It number one has sort of an overall higher pitch when we talk. Our voice tends to go up, sometimes as high as an octave higher because we're talking to the baby in a tone that's comfortable um, for them. And it tends to be slower in nature. That's the second thing is it's slower in nature. So we see long vowel sounds and things sort of drawn out for the baby. And um, so it's a very deliberate way of talking when we speak with them. And the third quality is it does have sort of that sing-song quality to it. So it's sort of lyrical in a way. And all of these work to engage our baby and it keeps them really interactive with us. And the the vowel sounds really help the baby kind of learn language and they're engaging and learning and interacting and also learning that mom and dad are paying attention to me. My caregivers are paying attention to me. And so it's really got this lovely quality to it that
Oh.
engages the baby and creates this loving, caring environment.
So when I was just upstairs, literally right before this interview, going, "You're so big. You're so big." That was parentees. Also so natural to do. Just comes
Mhm.
out like that. Yeah. So for parentees also, it sounds like there's some really great pros, like the connecting with the baby. Can you just speak through again the pros and cons of parentees in parents' language?
So again, I'll start with the cons.
Yeah.
So I don't see a whole lot of cons with parentees because it is engaging the baby and it is making sure that they feel loved and cared about. So it doesn't have a whole lot of cons engaged. Again, I would think maybe one of the big cons would be the societal idea of, oh, well, you're not talking to your baby like an adult.
Mm.
And we're sometimes I think trained to think that if you're engaging the baby in parenties, that lyrical sounding talk, that you're not letting them know what real speech should sound like. And really, research is starting to show that parentees is actually very helpful for the child because, again, like I was saying, there's those long vowel sounds that kind of draw out, and the babies are learning speech through that, and they're engaging actively in their speech by not only cooing and babbling with their caretaker, but it starts evolving, and as they hear their caretaker mirror back to them words and speak to them, um, they start learning language and they start to be able to absorb language. Um, and again, it also creates that loving, caring connection between parent and child. So I really see it's really more of a positive than negative. So I encourage the people I work with to engage in parenties with their baby and really take that time to interact with them and make those connections because it helps with language development, it helps with brain development, and it also helps with that social development too. It creates that bond between parent and child.
Mm. That's so interesting that it's the sort of like societal idea that I'm not teaching my child language correctly. Because I think that's what my husband
Mhm.
was saying, or that's what he was worried about. He's sort of like an academic and really thoughtful about things. And so I think to him that, and this, I think maybe it was even before she was born, he started talking about like, I'm not going to talk to her like that because now I watch him, and of course it's like almost impossible not to do it because it's so natural. And it's so lovely to hear that it's really important for their development. So what we're doing is really helping her develop. The third term that popped up is infant directed speech. Can you talk through the definition of that as well?
Okay. So what is infant directed speech? Infant directed speech really is essentially, when you break it down, it's speech that a parent or caretaker is directing towards their child. And so it can really be another name for parentese or baby talk, because it's us engaging with our baby. It's us taking that time to direct our attention to our baby and make sure that they're engaged, they're feeling cared for, they're experiencing interaction on a very intimate level. And so infant directed speech really encompasses all of our talk that we have with our baby, whether it's baby talk, if it's parentese, or even if at times we do our adult talk towards our baby. All of that can really be considered infant directed, because we're taking that time to engage them and direct our speech right at them.
Got it. Got it. Thank you so much for breaking down those different definitions that just kept popping up. And sometimes when I'm reading things online or reading journal articles, it can be so hard to break down some of those terms. So that's super helpful. How has parentese shaped our traditional understanding of baby talk?
It's really evolved over the last few years. Baby talk used to, like I said previously, baby talk used to be thought of as it is language at our that we direct at our babies that is mostly consisting of made up words, cooing, and talking in high pitched tones, and sort of just kind of babbling with our baby. And parentese has really kind of shifted that thought process around what baby talk is, because parenting has taken it from our babbling and our cooing, and it's turned it into um, speech that is directed at our baby, and it's actual words, it's actual language. And so it's really shifting our perspective, because we're no longer looking at the cooing, we're no longer looking at the babbling, we're now looking at its language. It's we're talking to our baby in a way that interacts with our baby. It makes sure that our baby's engaged with us. And so parentese, I think, has been a really positive shift too in just the overall idea of what baby talk is. And I think it has really lessened that stigma of talking to your baby in these high pitched, kind of sing songy tones. So I really see it as having created an environment that's more friendly to really kind of getting down on the level of your baby where your baby's comfortable, and creating that dialogue that helps the baby kind of learn how to talk and learn how to engage and create social interaction.
I love that. There's so much to worry about being a new parent that it's just so nice to hear that like this natural thing is this language that's helping your baby develop. So as I watch Remy get older, she's almost 8 months actually already. What are some common speech development milestones?
Kind of starting at the beginning. At about 3 months of age, babies start listening to our voices. And this is really sort of like the foundation of when speech is going to start happening. And so it starts really, really early for babies. So they start watching our face as we talk. They'll turn towards our voices, and when they hear sounds, they'll start turning towards them. Um, and they'll also, at this age, start to coo and maybe make happy little sing-songy sounds. And so at 3 months, we're starting to see sort of the introduction of their ability to start vocalizing. Um, so then we move on to at around 6 months of age, baby has done some more development. they're starting to babble now. So it's sort of evolved from just cooing and making cute little coo sounds to now there's actual um, babbling, and they're making different sounds, and they're sort of really kind of testing the waters of what they can do um, vocally. Um, and so then this is when they start saying things like baba and dada. Um, and so what we're seeing is a lot of parents think dada is the first word because they're saying dad. And really, I hate to burst anyone's bubble, but really they're saying dada because it's what they're able to do with their mouth when they're first learning. It's that physical ability that they're developing, and those are really easy um, sort of words for them to achieve at that point. And so you'll start hearing them actually starting to attempt to make words. And so you'll start getting that babbling of baba and dada and certain words that they feel are achievable for them, basically. Um, so then at about 9 months of age, we start seeing babies actually not just mirroring sounds, but they're actually starting to understand things. And their language development is really starting to build up momentum. Um, and so at 9 months, you start hearing them say basic words like no. And so that's a really popular word about 9 months of age is you'll hear that no, and it's because they're able to do it. And so it's sort of like little kids will latch on to what they can do, and we can say no, and so you'll hear no a lot. You'll also hear bye bye a lot. And so they'll say bye bye to strangers in the store, and you'll start seeing that development occur. Um, so um, you start hearing no and bye at 9 months of age, and these very simple words start to come into play. Um, at 12 to 18 months, most babies will start to say a few words and more complex words like mama and dada, but more like dada as in dad, where they're more connected. Our previous dada at about 6 months was more of a da, and now we're seeing it become more complex where it's connected. It's dada, and you'll hear mama. And so you'll start hearing these more complex words start coming out, and they're really starting to understand what they're saying. And so when they say mama, they know they're talking about mom. When they say dada, they know they're talking about dad. Whereas earlier at 6 months, when they were saying dada, it was just sort of a word that they could say. Now they have association, and it's starting to make connection for them. At 18 months, babies start saying a few simple words, and they can also start identifying things when parents start saying them. Um, and so they'll point to people, they'll point to objects. Um, when a parent says brother, they'll be able to point to brother and understand that brother means my sibling. So they're really starting to develop language and understand language by 18 months. And you really start seeing them sort of blossom at this point too. Um, the other thing at 18 months is their ability to say words is very developed, but it's not fine-tuned like adults have. So you'll see them start to chop off the ends of words. And so they'll sometimes say words with the R's dropped off the end, or a lot of your hard consonants, and they'll end with a softer sound. But they know what they're saying, and they're understanding it, and they're really starting to develop their language skills at this point. At 2 years of age, you start seeing um, babies start stringing together words into phrases. And so this is when we really see a huge blossom, and they start to have abstract words and thoughts. And things like mine starts to really become something they actually understand. And so that's why you'll see 2-year-olds will grab things and go, mine, because they're understanding that this idea of belonging is now there. And so you really start to see a real bloom too in their ability to think abstractly. And then our final milestone is about 3 years of age. And this is when we have really sort of an explosion of language and an explosion of their ability to think abstractly. And this abstract thought really, they start being able to understand things like feelings. Whereas at 2 years old, feelings are really ambiguous and they can't understand them. At three, they're starting to be able to put words to feelings, and start understanding what sad means and what happy means. And so you really see this explosion of their language and their thought process at 3 years old.
I have to say, I'm so excited to like get to know my daughter. I've been thinking about that as I'm watching her just begin to develop this personality, and hearing that, by 3 years, she's really going to be expressing emotions and she's going to be stringing words together is so exciting. I'm so excited. One thing you said, at 9 months, I think you said it was around 9 months, they can start to say simple words like no. And I'm wondering, do they understand no at 9 months? Because I know I had read that like saying, so she's 7 months right now, like I said, and I read that like saying no to her right now, she doesn't understand what no means.
At about 9 months old, they actually are starting to understand those things. So 9 months is sort of a month where you start having a pivotal moment of, it's no longer just words they're hearing, but there's actual um, thought behind it as far as understanding and being able to see where, oh, no means that I can't do that, or no means we're not going to, or so they're better capable of actually starting to understand these simple words like no, or
Mhm.
like bye bye. They'll start to understand that bye bye means someone's leaving. And so you start to get basic comprehension at 9 months.
Awesome. That's good to know. Yeah, I was reading about like you can't really discipline babies. I'm a breastfeeder and she's started to get her teeth. And so she's started to bite me. And I was trying to learn how to, one of my like many Googling things, I was looking up sort of how to prevent that. And I was reading, they don't understand no yet. So it's interesting to hear that by 9 months, that communication piece is she's making the connection with those words. So I know I've wondered about, when does Remy learn what words mean? Like when I say no to something, I've been wondering, like, when does she learn what that actually means? So can you speak to, when do babies really link meaning to the words that we're using?
Okay, so when do babies link meaning to the words we're using? At about 9 months of age, babies start to begin to understand words like, and simple words like no and bye bye and things like that. So what we're getting at 9 months is, where it's a transition period where we're going from um, un- just listening to words and having words um, be sounds to, we're actually starting to have comprehension behind the words. And so when they hear no, they're starting to link that no means I can't do that, or no means we're not going to. And so no starts to actually have meaning at about 9 months of age. And along with other simple words, like I said, bye bye, they start to understand at 9 months of age that bye bye means that someone's leaving. They're going away, and so you'll start seeing kiddos in the store that they're probably about 9 months of age. They're saying bye 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 to people randomly, because now they understand it, and there's meaning behind it. And so at 9 months, we start to see this real blossom of their ability to have understanding and cognitively know that words aren't just sounds, words have meaning. And so it's a really great age because you start seeing this sort of revelation and piecing together of these things I've been saying, these noises I've been making actually have meaning behind them.
So what matters more when you're communicating with your baby? The actual words that you're using, or the like behavior behind the words? And maybe that would be different from different months, because it sounds like before 9 months, they're not understanding as many words versus after 9 months.
When we're talking early months, like you mentioned, um, when they're before 9 months of age, really, it's the behavior. What we're looking at is we're looking for that engagement with the child, and um, making eye contact and making sure that the baby is getting individualized, uninterrupted attention. And so we're looking for also the big movement where we're doing the sort of uh, parenties of talking to them in those sing-songy manners. And the sing-songy manner does help because it helps keep the baby engaged. And it helps the baby to start to hear that language has certain sounds to it. And so really it's the behavior at the beginning, the sing-songy nature, the engagement, and just sort of the sounds in general. As we start to see them get older and around that 9 month period, um, we can still do some of the cooing and babbling if the baby is engaging in that. But we do see a shift too towards importance in actual language, so that way babies start to develop their cognitive abilities to use language actively, because this at 9 months this is when they're starting to comprehend things. And so we do want to see sort of a shift in the baby talk, and in the parenties, to where um, we're engaging with the baby in the same way, same sing-songy manner, but we're using verbiage so that way the baby can start learning language as well. And so making that connection between what they're verbalizing and what we're verbalizing in actual things.
Awesome. That's so interesting. So we talked about baby talk being really natural. Does it ever harm babies' language development?
The thought used to be that baby talk would teach them how to speak incorrectly, they wouldn't develop proper language skills, and that it was a big no-no. And more current research is actually showing that baby talk actually is helpful for the baby, and it encourages the baby to interact with their caretaker. It encourages the baby to um, create social development. And also, baby talk is sort of in a way wiring our baby for language. And so, baby talk really, especially when babies coo and they babble and things like that, it's their natural language development. And so, what we're doing when we baby talk is um, we're mirroring back and forth with our baby their natural language. And so it's helping them to develop their language skills. It's helping them to learn how to control the muscles on their face so that way they can actually speak. Um, and so baby talk actually has a really good amount of benefits to it in creating social engagement with your baby, in creating a sense of security and intimacy with your baby. And then it also helps babies develop their language skills. And so overall, baby talk really is beneficial, and it does have a place in babies' natural development.
Is there I'm just thinking, I have a friend who their son had to go to a speech language pathologist, and we were just talking about this the other day. He was just developing language a little bit later than the milestone. And their doctor told them to use simpler sentences with him. So in terms of like when they're babies, we're using baby talk. As kids get around like 2 years, 3 years, is there like baby talk for slightly older babies?
It sort of develops a little bit, and so it might not be quite as sing-songy as we have with our little babies. But once they're about 2 and 3 years old, we can kind of talk to them in a way that they're possibly more receptive to. Um, so still maybe a slightly higher pitch when we talk to them, so that way it's sort of a soft tone that they're possibly more receptive to. Um, we also see in that age range too, where sometimes parents want to see their 2 and 3 year olds as little adults,
Hmm.
and so they try to engage them in adult speak in adult language, and sometimes they're just not on such a solid developmental ground to have that adult language. And so sort of using simpler sentences, like you said, kind of keeping it more in tune with what they can comprehend in language, actually is more beneficial to them. Um, Again, when you're looking at 2 and 3 year olds, um, they're just, especially at 3, they're just starting to develop their ability to comprehend abstract thought and understand that other people may think differently than them, and so their language reflects that. And so when we try to engage them in speech that we would use with other adults, sometimes they just can't grasp what we're trying to get at with them. And so breaking down language into simpler sentences, things that are more age appropriate as far as their comprehension, actually helps babies develop language um, more solidly as they develop, and eventually their language starts growing and expanding beyond 3 years old, and as they enter school it will grow and expand. But during those early developmental years, you do want to make sure that you're adjusting for them and making sure that they're understanding at their level what's going on, and what you're trying to tell them and the messages that they need to hear.
It's nice to have a roadmap of where we're going to, like knowing that parentees right now is really helpful, but then that, as she gets older, to construct those sentences so they're shorter, sort of matching her development. That's really helpful. Thanks for sharing that. When you talk about parentees and baby talk, you talk about using a sing-song voice. Can you just give a few more examples of what a sing-song voice is and what that means?
Okay, so what is a sing-song voice? So I actually accidentally just did that right there. So sing-song is sort of this pattern. It's very lyrical, and so it's when we're speaking to babies, it's sort of like, "Who wants to go to the park? Is baby excited? Do you wanna go swing on the swing?" And so that upward inflection and then downward inflection, kind of rocking back and forth, those tones are our sing-song tones. And what they do is they engage the baby, and they help the baby, to focus their attention on us, because research has shown that when we do the sing-song voice and we go up and down in our voice, they tend to really be drawn to that, and so then they're drawn to the language that is associated with that sing-song tone.
So you've talked a lot about baby's language development from like 0 up through 3. So when we're talking about that language development and helping baby learn how to talk, what would you say are like the 3 most important things to keep in mind?
The 3 most important things to keep in mind, when we're working on our baby's language development is, number 1, making sure that our baby's engaged. So we wanna make sure that we're making eye contact with our baby. We wanna make sure that we are caressing baby and having physical touch be part of our interaction with baby, because it helps keep them engaged and it helps build that social interaction that's important with language development. We also want to utilize the 3 main characteristics of parentees when we're working with our baby in their language development, and that would be utilizing our high pitched tone when we're talking with our baby, because that also has been proven to help create that engagement with baby, and they're attracted to high pitched tone. According to research, it helps them maintain that engagement and attention. We also want to make sure our language is slower in nature and that we're not rushing things when we're talking to them. So that way they can not only hear the words, but hear the sounds that make up words. And so that way they can start having that ability to create not only language development, but also comprehension of the language. The other thing we want to remember with parentees is to use our sing-song quality, because it also keeps them engaged, and it creates also sort of like a fun atmosphere for baby. They'll tend to be drawn to the sing-songy tone. Um, and really, I think the third important thing that we do when we're creating language for baby is that um, we we not only show them how to speak, but we're showing our love and care for baby, and we're creating an atmosphere where baby feels free to coo. We don't want to, quiet baby, stay quiet. We want to make sure that they feel like, you know what, I can interact with mom, I can interact with dad. And so we want to make sure baby is in a loving, caring environment that welcomes their interaction with you.
That's so important. I'm so interested in you talking about in those early months where baby's learning language, that engagement, that active engagement is really important. And you said specifically touch is part of that. And that is interesting to me because I was watching a documentary where they had been doing really specific research around just cooing and talking to baby and where that lit up the baby's brain, and then cooing, talking, and touching. And it was like the whole brain lit up. Can you speak a little bit more to why it's really important to include physical touch when you're engaging baby?
Okay, so why it's important to include physical touch when we're engaging baby. Um, so physical touch creates connection. And not just physical connection, but physical touch creates emotional connection.
Mm.
And so when we're emotionally connecting with baby, um, babies tend to, like you said, their brains light up on scans when you have engagement with physical touch. Um, it's wiring their brain for connecting on so many levels. So they begin to associate our language with loving and caring. Um, it creates an environment where babies um, really start to see that um, mom and dad are important. I'm important, and it really creates an atmosphere where baby starts to develop um, a sense of calm, a sense of safety, um, and it also creates a sense of connection with so many people. And all of that helps breed language skill also, because when baby feels connected and baby feels loved, baby also feels like I can express myself. um, I can talk. It's a safe environment. And so what we see is we see an increase in positive brain development for baby when baby does have physical connection in conjunction with their language development.
Mm.
And they actually develop language a little quicker when you do have that physical engagement involved. And so when you're holding baby and feeding baby and talking to baby, all of that creates a perfect situation where baby actually is getting not only loving and caring from caressing, they're also getting their needs met by being fed, and that shows loving and caring. And then the interaction with language is another layer of loving and caring for baby. And so all of that in conjunction creates a wonderful environment and situation where baby's brain absorbs all of this and it develops in a lovely way that helps baby blossom.
Mm. Thanks for connecting those dots. That is so interesting that those different pieces of physical touch and then language kind of working together. This has been so fascinating. Thank you so much for being here to answer all my questions about communication and babies' development. It's been really great to talk to you, Dr. Hightower.
Well, it has been my pleasure. Thank you so much for having me. And if anyone has any questions, feel free to reach out to me. My email is info@tabh.org. And I am also on social media on Facebook and Instagram. My practice is Torre Alta Behavioral Health LLC. So if anyone would like to reach out, please feel free to contact me.